Driving simulator. There's some evidence that using a driving simulator actually will be beneficial in getting people to learn driving. Now, with the renovations that are going to be coming with Niagara Rehab in the next little while, not that you didn't know that, but it's happening. And part of the thing is they're going to have a driving simulator. And so that's something that's very important. It'll be helpful for the therapists. Again, looking at people who are going back driving, something else you can do. I mean, ideally, it'd be nice to stick the person behind the wheel and let them drive, but it's kind of dangerous. And you're not going to have many therapists going to go in the cars. So this is something to think about. Okay. For when asked about questions, no questions on marital relations in this audience, okay? If you want to talk about these things, you have outside of this room. But I thought it's important for the idea. A lot of people have questions about when they had a stroke. When can I go back? You know, when can things start? A lot of the problems is that the doctors are younger than the patients are older, the therapists are young, patients are embarrassed to ask the therapist anything. I think the idea is that by bringing up to the topic, it's something for people to know about. If it's something that's a question, I don't think people should be afraid to say anything. But it's going to be dependent a lot on your medications, on physical function, on your thinking process. And that's all we're going to say. The last thing is travel. A lot of people after stroke say, can I go some places? And I always say, as long as you don't have to fly the plane, you probably are good to go places. The most important thing is medical clearance, is making sure you're taking the right medications, you're not sick. The medical part is probably the easiest part. It's pretty simple to say, yeah, you look good, you're fine. The problem is going to be insurance coverage. Because if you go to the States and you have a stroke, are you going to have coverage by whoever to look after you? It's quite expensive, and to bring you back up to Ontario or wherever you're going to. So a lot of it because of the insurance company. Your insurance, whoever's covering for you, a lot of them will have stipulations saying you have to be medically stable for 6 months, which means no change in your medications. Okay, so what I tell people is medically, if you make sure they're fine, you say, yes, you're good, check with your insurance company. People can fly after stroke. People can go on a boat. People can go on a train. People can go in cars. If you're going to go for long trips, I always tell people you got to get up and move around a little bit. People are prone to blood clots. Okay, everybody is, particularly even if you didn't have a stroke. So everybody should do this anyways. But the idea is you need to get up and move around, or even just try to stretch your legs a little bit, or move your legs. And the whole idea is, and that's if in a car, a train, whatever you need to do. Okay, so traveling is a good thing. People can travel. People can go on cruises wherever they need to, but always make sure you have insurance coverage. Okay, so this is a summary. We talked about stroke as being a leading cause of disability and death. Stroke has several controllable and uncontrollable risk factors, hypertension being the #1 controllable. By recognizing symptoms of stroke early, a cure is available. Remember, I put cure in quotations. It's not quite a cure, but it's close to it. Rehab plays an important role in reducing the disability seen in stroke, and life still occurs after stroke. Okay, and so if you ever want to review evidence regarding, if you guys have nothing else to do and you want to look in the computer, there's a website, www.ebrsr.com, which is an excellent review of all the literature regarding stroke rehab. Dr. Teasel is a physiatrist in London, and a group of individuals have gone through all the data from, it's always being updated. I think the last edition is, like I said, is 2010. But it's being updated all the time. And you can find things like hyperbaric oxygen, does it work? Acupuncture, cortisone injections for a painful shoulder, speech therapy, OT, PT, bracing, all the things you might not want to know about. But you can look at these things and it'll give you some of the evidence about these things working. And it's an excellent website, and you can trust the information from that website. Heart and Stroke Foundation always has good information on risk factors and some of the current statistics regarding stroke. Okay. So thank you very much. Anybody have any questions? Hopefully that does say thank you, because I don't know what the other ones say, but yes?
You were talking about secondary prevention.
Yes.
Somebody's had a bleeding in the brain, that's the stroke.
Right.
Can they take aspirin?
She was asking if the person's had a stroke already, if they have a bleeding stroke, can they take aspirin? Again, individually I'd say, right off the bat, I'd say no. But depending on other medical problems, they might be able to take aspirin. But at this point, I'd say stay away from aspirin.
You talked about, you mentioned flavonoids.
Flavonoids.
Could you tell us what they are?
Yeah, I shouldn't have said that in my talk. Flavonoids are, it's like it's a product within grapes themselves. It's not a protein. I'm an oid basically. I should know what this is, but it's within the. It's a part of the food itself, in the grapes. It's part of the grapes themselves and the breakdown when the grapes are extracted, basically. Because eating grapes themselves don't work. They don't have flavonoids. It must be the process of actually extracting the juice from grapes. Must make these. I'm not sure it's a protein, but it's actually part of the juice of a grape.
So you're talking about wine?
Yeah, red wine particularly. It doesn't in white wine. It's red wine. But like I said, if you don't drink, there's not enough evidence to say to start drinking. But if some people can't take aspirin after, and some people, the doctors tell them to have a glass of red wine every day for prevention of a stroke.
Well, you see an advertisement now on TV for lipoflavonoids for ringing in the ears. Is that
I don't think it's the same thing.
no?
Lipo would be something to do with fat, and it's something different. If you look up in the website, you probably could. If you looked up in the computers, you could find out. I'm not sure exactly what definition, but I know it's part of the extraction of the juice from a grape. Okay. Yes.
Dr. Gifford Jones says it's okay to have a martini every night. Is that all right? Small one, like about 2 ounces.
I'm not sure what to say. I don't know. I'm not sure what to say. From a stroke point of view, I wouldn't be able to say anything, but check with your doctor. Yes.
If a person has had a stroke, should she stay away from 81 aspirin or the regular aspirin?
If they've had a stroke, if they're taking an aspirin, or to avoid if it's a bleeding stroke.
If they've had a stroke,
Right.
should they continue taking or stop taking?
If they had 81 milligrams, the other thing with if you had a stroke and it's a clot stroke, if the person's on aspirin, often they'll switch them to Agrinox or one of the other medications. Some people will be on both. So some people will stay on aspirin even if they've had a stroke.
Okay.
Again, that's why I said it's an individual thing by your doctor, because everybody's a little different. It's hard to say, this is the recipe, this is what you're supposed to do. But sometimes people still stay on a baby aspirin.
Thank you.
Your chances of having a stroke on the table?
So if you have, she's saying if you have narrowing of the arteries in your neck and you have surgery, what's the risk of having a stroke? I actually have the numbers. It depends on the surgeon that does it. But it does. It's really dependent on the operator. So you always, if you have the surgery, ask them how many times does someone have a problem. But it's about 2% of people will have a stroke during the procedure.
Do they then treat them with that?
No, because they had surgery. And they'll bleed. They'll cause abnormal bleeding. So often, depending I guess when it happens, but no, when if you have someone who's narrowing the arteries, the risk of having a stroke is reduced by about 18% is the number if you have surgery. If you don't have surgery and you just medically manage it, so that's using the statins and using blood pressure medications, etc., the risk is only reduced by about 6%. Okay, so there is benefit for having the surgery, but unfortunately there is a risk of having a stroke, and it happens. Some people will actually have a stroke before they have the surgery. They're just waiting up to it. We've had people at Shaver where they were supposed to have the surgery, but because we were waiting for it, and they ended up having a stroke, and by the time they checked the net artery again, it was completely occluded. So there's nothing they could do about it. Yes?
Once the artery is completely blocked, what are the chances of having another stroke?
It'd be the same as anybody else who has any of those. Once an artery is completely blocked, there's nothing you can do about it. You can still get blood supply to the brain. It's just like, if you have an accident on a highway and you can't go that one way, you have a different way to go. That's what blood happens. But once it's blocked off, your chances are basically the same as long as you take your medications, and that's where it's important. But it doesn't make you any higher than anybody else. Yes?
How often do you have TIAs, and does it eventually lead to a major stroke?
That's a good question. A TIA is what's called a transient ischemic attack. So that's like a mini stroke that people, and that's so you might have symptoms of a stroke, but often the symptoms will go away within, well actually the definition is within an hour. But if someone's having a TIA, you don't know it's a TIA or a stroke, so the person should go to the hospital. So if someone's had a TIA, the numbers are 30% of people who have had a TIA will have a stroke, a major stroke within 5 years. So if someone's had a TIA, I would go to, if it happens while you're happening, you should be calling 911 while it's happening. If it happens quickly and it stops, you should be going to your doctor, and that person still needs to have a CAT scan, Doppler's done of the neck, they still need all the workup done. They need to still be on the medication like aspirin or what are the medications they talked about. That person needs a workup, because if they don't have a workup, they're going to have a stroke. So that's what we're preventing. So if a person has a TIA, it's like a warning sign, and your person's lucky if they don't have any major deficits.
How often do you have them? Like, do they?
Oh, they can happen. People can have them frequently. It's not really a number. People could have them like repeated in a day. They can have it over several months. It's not one, depending on what the cause is, it could keep happening if nothing's changed. Yes?
What is the symptom of a TIA?
It's the same of a stroke. So a person could have a headache, speech problems, vision problems. You can't tell it's a TIA. That's the problem with it, is people say, oh, I'm just having a, something happens to you and you're going to wait. So by definition, the symptoms resolve or completely resolve within an hour. Okay? But you don't know at the time whether it's a stroke or TIA. No one knows. And even at if you go to the hospital, they don't know. But they're going to work you up. They're going to work you up as if you're having a stroke. So if you need TPA, they'll do TPA. They'll do whatever they need to. Yes?
If you have one of those TIAs, does that even protect your insurance for going?
If you have a TIA, he's asking if it affects your insurance. You mean for like traveling and stuff? Yeah, it would if they know about it. And if they knew you had a TIA and then you went to the States and you had a stroke, I imagine their lawyers and stuff would probably look at things and see whether they can somehow get out of paying for whatever happened to you. Just for TIA and driving, if the person's had a TIA, they technically should not be driving. They should see their doctor. The doctor should work them up, so investigate them, CAT scan, all these things, make sure they're on the right drugs. And then if everything's fine, then the person can go back driving.
What if you have that operation after you've had the TIA?
You mean the endarterectomy? I think technically the idea is, you mean for insurance coverage? Well, depending on whose policy it is, it depends. I think it's about, I think on an MRI, it's about 30% of people who have TIAs will actually see evidence of damage on the MRI. But again, is it because of that event or because of something that's been happening in the past? So most times the definition is you wouldn't see changes on a CAT scan with a TIA, though it's not completely true, but overall you wouldn't see anything. So they'd say a normal CAT scan, but by that time they do all those things, your symptoms are probably going to be resolving, and so they're going to know it's a TIA.
What tests should have been done beforehand?
So if you have narrowing of the artery and knowing whether you need surgery, first of all, they need to know your health. You might need to see an internist to check out your heart to make sure you're able to handle the surgery. You're going to need to probably have a Doppler done as an ultrasound of your neck. The surgeon may order angiogram, which is where they inject dye into the arteries to see actually how much narrowing, because a Doppler it's sometimes hard to get a good picture of how much narrowing it is. And
Angiogram, is that like a CT?
off a CT angiogram. So what they'll do, they'll give them a dye, and then they'll do a CAT scan of the neck, and they can actually see how much narrowing of the arteries is done. That's usually what is usually done before anyone has surgery. Okay, thank you very much.